Life is so funny that like full circle, right? Like
Yeah.
we were talking to the producer about how long we've actually known each other
Yeah.
and pretty much our entire adult
Yeah.
lives.
Half our lives at this age.
I know.
Yeah.
And just that is wild when
It
you think
is.
about it. We both met at OU.
Yep.
And also was just telling our producer, like, I gotta just call you Rachel because
Yeah.
it's just my mouth when I see you is like, hey Rachel, like,
Yep.
you
Yep.
know what I mean? Like, because that's the kind of relationship we have, right? Like, so it's like really good to have you here
I'm happy
today.
to be here.
And I've been like so excited to just like see your platform grow and to support you. And I wish we were here for different reasons.
Yes. Yes.
But you were already like working in the healthcare
I was.
field. So, you know, not too far of a jump, but we're actually like, it's always interesting when what you're doing actually shows up for real, like in your real life. Like,
Yes.
and I think we're like gonna talk a little bit about that today. So
Okay.
I just appreciate you for coming on.
Thank you for having me. I'm happy to be here.
Of course. I wouldn't have had anybody else. Like I said, I've known you for a long time, so I know you're thorough. I know you know what you're talking about. I don't like to give platform for people who aren't going to tell the truth.
And I'm going to tell the truth.
Yeah. And by that, I mean, like, truth is objective, right? Like, what one person thinks is true could be very much true to them. However, when it comes to health, I like to stick to the facts.
Yes.
And I think what I've seen is an uptick in over the last couple of years is a lot of misinformation around. Like, too many people have a platform to just tell people anything.
Yes.
And I think that in particular when it comes to us as Black people, like, we need to be like really vigilant and making sure that people really know the facts.
Yeah.
And that not only like, because Columbus Can't Wait is like a not just a political show, but a show about community. Like, this is how we show up for each other in community. Is really like pressing people about how they're taking care of themselves. Not to judge them, but just to say, hey, I know about this thing. Have you considered this? Have you thought about this? And I feel like that's what you're doing on your show, Black Health Lit.
Yes. Yeah.
So, I want to introduce you. We have Rachel Crowder on the show today. She is the founder. Is it executive director?
Either works.
Your CEO?
Either works.
She's the boss. She is the boss at Black Health Lit, which we're talking about as it's a podcast.
Yes.
But it is also a consultancy firm where Rachel consults with lots of different organizations and corporations around health equity.
Yeah.
And so she's here today to talk to us, not just about her story and my story, but to talk to us about health advocacy, and health policy in an election year.
Yes.
So
huge election year. Every year is huge, but this one is
just
this one's different.
This one is just taking me up. It's a lot.
Yeah, it is.
It's a lot. It's a lot to absorb. I think we're close to the actual election, and I think like we're still somewhat unclear about policy.
Yes.
And that's on Trump's side. I don't know why. I mean, we're clear on his policy. His policy is Project 2025.
Yes.
However, if you let Donald Trump tell it, he will tell you that doesn't have anything to do with him.
Okay.
They made that big book. I just don't think they made it to be, collecting dust. So his agenda is Project 2025 or Agenda 48, I think is what he's saying. It's his. So I'll just
he's trying to rebrand.
Well, he tried to rebrand it. I'll put that out there just for the sake to say that I said it. But Kamala Harris, because she got into the race so late, we're still not fully clear on the policies. Right. So I think what we'll talk about, of course, is just like what is like some of the general stuff that is like coming down the pike, needs to happen, or is in like process.
Yeah.
So as you said, it's like a huge election year. How are you feeling?
I think that first, going back to your point about people not understanding policy and how it relates to health and the misinformation. So we see a lot of clickbait and people being opinionated on things. And most of the time, people don't know what the acronyms even stand for. Like CDC, for example, I had someone ask me if it was the COVID Demand Center one time. And it is the Centers for Disease Control and Prevention, so just things like that. There are official bodies that impact our lives every day. And who's in office from the president down to city council impacts that. It really does, because legislation is how we get access to things. So, for example, I'll use insulin. Insulin is expensive, right? And so this current administration under Biden and Harris enacted the Insulin Affordability Act, which basically caps the amount of cost sharing, which is like your copays and deductibles, to I believe it's $35. That's huge.
Right.
If you don't have your insulin, you die. So draw the line to who's in office can impact whether you live or die.
Absolutely.
Literally.
Yeah. And that is one of the things that I talk about when people say, oh, Biden didn't do anything. Like, do you know anybody that's a diabetic who needs insulin?
Oh, we all do.
Yeah, we all, because we're like, as Black people, we have high rates of diabetes. Like, we all know there's someone who has it. So that is, like you said, a direct line. And I want to talk more about that, like that through line of like organizations like the federal organizations like the CDC and down to city council and how it affects folks' health.
Yeah.
But first I want to talk about how you decided to start Black Health Lit, because you were working at a large healthcare organization.
Yep.
How we all did, kind of left college and got these jobs at big organizations.
Yep.
Felt good about the work that we were doing, at least for the time.
Yeah.
And what made you kind of spin off and decide to start Black Health Lit?
George Floyd.
Okay.
So after undergrad, when we graduated in 2009, that was one of the many economics.
People to hear.
One of the many economic downturns that millennials have faced. I couldn't get a job. And that literally is the only reason I went to get my master's in public health. It wasn't because I was
oh my gosh, we have the same reason.
Yeah, I wasn't being ambitious. I was surviving.
Facts.
And I needed a refund check.
Exactly. That's why I got my MPA, because I was like, I need to find something to do because I can't find a job. It wasn't because I love school.
Yeah, exactly. So fast forward, when I was in my MPH program, we talked a lot about food deserts and health disparities and just how public health fits into that. But it wasn't a buzzword yet. So when George Floyd happened, when George Floyd was murdered, a lot of people started talking about health disparities and how racism was a public health crisis. And there was a lot of
Columbus declared.
Columbus is one of the cities that did declare racism as a public health crisis, and many municipalities did. What I saw missing from health systems and different entities was something tangible and something truly focused on Black people. And so as somebody who worked in healthcare, I think I was at like year 10 or 12 at that point. And I had worked on a project, and it was to address health equity. But the reaction let me know that this was more of a marketing exercise than it was about creating true health equity. And so I have a Serenity room in my house. It's got candles, massage chairs, all that. And I was in there one day and I was like, God, I need to do something. What can I do? I don't like germs, so I'm not about to operate on nobody. And then the word Black Health Lit literally just popped in my head. And I said, literacy. Literacy is the way, because at that point it was November, December of 2020. And by now, misinformation was at an all-time high because we were in the middle of
Right.
the COVID
We were
pandemic.
dealing with the pandemic and we were dealing with what folks like to call as the racial reckoning, but we've been reckoning with that for
sure.
our whole lives and
Yeah.
for generations.
Yep.
So those two things sound like they converged
Yep.
and helped you make that decision.
Yeah.
I want to roll back a little bit because something that you said really resonated with me, which is like recognizing that all of these like commitments that were being made and all this like lip service that was happening
Yeah.
was actually just a marketing exercise.
Yeah.
Can you say more about that? Because I'll tell
Absolutely.
you, just like in my experience, it's, oh, we're doing this, but there is the plan on how to get there, right? To really like engage community.
Yeah.
And to really understand what folks lived experiences.
Yeah.
Not just the disparities, but what is people's lived experience within like systems, right?
Yeah.
Is always leaves a lot to be desired in a lot of spaces.
Absolutely. So when I say it was a marketing exercise, it's like, say you have an organization and you have this huge Black History Month or Pride Month celebration and display at the front entrance, which a lot of retailers do.
Mm-hmm.
But then when it comes to supplier diversity, you have 99% of suppliers. We live in America where money matters. This is capitalism. So put the money where you're putting your marketing. And so I think we saw a lot of that, of red, green, and black marketing and hashtags and social media graphics of health equity matters and racism is a problem. But then when it comes time to say, okay, put a hospital in Linden, put a health center that's permanent, put a health facility that's not on wheels and going to leave and pack up at the end of the day in an area where people are underserved.
Mm-hmm.
Now we're having a different conversation.
Mm-hmm. And you can absolutely see when you go to hospitals in different neighborhoods, you can see a difference between the facilities,
Yes.
the type of regard you're given, follow up.
Yeah.
You can absolutely see a difference depending on who the demographic is serving, and it is gross.
Yeah.
And it does so much harm, like down to, we were talking about, this is life or death.
It's life or death.
Right. And there shouldn't be a difference between, if I go 10 minutes down the road, I'm going to receive a different level of service.
Yeah.
Than if I'm in a neighborhood like Linden.
Or any service. Mm-hmm. So like in Columbus, being here 10 years, I've learned how detrimental I-71 was to the Black community. Mm-hmm. So I would challenge people, if you're on Google randomly, Google health systems or health provider Central Ohio. And what you're going to find is there's hardly any services inside of 270 east of 71. Mm-hmm.
Yeah.
Who lives there? Black folks.
Yeah.
So it's west of 71, there's a plethora of services. And then outside of 270 going east, you're going to see healthcare providers that are permanent. Now, there are some mobile units and services that are available. But if you just jump on Google and say, I need a doctor or I need to go to the hospital or a health facility, it'll be very limited to none in that area.
Yeah, absolutely. And the point that you made about like having health services that are not on wheels, it's like there's a relationship building piece.
Yeah.
To being able to go in and like build a relationship with a physician or some other healthcare provider. That person knows you, right?
Yeah.
It's beyond just knowing what's in someone's chart, but actually like knowing that person.
It is.
So there is so much value in, like you said, having permanent hospitals, permanent solutions in community. And this is where we see racism show up. When I talk about the Black maternal health crisis, right? Like for a long time, people were trying to figure out, why is this happening? Why is this happening? And the reason is just racism.
Yes.
That is not just racism, right? But that is the umbrella, reason, right?
It is.
And I think that folks are still so uncomfortable with talking about race that the people who were looking at the data and the people who were doing all the studies and all of that were just like, that can't be the reason.
Yeah.
But that is, now that, folks are starting to really dig deeper and really make these commitments that recognize social determinants of health, that is the reason. It's not, Black women or Black people, because the blame was always, well, Black mothers, they need to do better.
Yeah.
No, it's actually not the reason.
The system needs to be better.
The system needs to do better.
To give people the opportunity to achieve optimal health.
Absolutely. So we're definitely going to talk more about that, but I want to talk also about your own personal story.
Sure.
So I remember seeing you a couple years ago. I think I saw you at East Market.
Yeah.
We had a normal just catch up conversation. Hey girl, how you doing and everything. And I was like, hey, how you been? And you're like, talking. Yeah, I'm like, I forget what you said exactly, but you said you were either in the midst or like at the tail end of like your cancer journey.
Yeah.
And I was like,
Mm-hmm.
Because at the time we were early mid 30s.
Yeah, 34. I was 34.
Yeah. And I just wasn't expecting for you to say anything, like just definitely not the C word.
Yeah.
And I was like, oh my God. Like, I think I said that to you, like, oh my God, for real? Like, I could not believe it. And I think it's because we attribute cancer to older people.
Yep.
Right.
Particularly old white women. If you look at marketing for breast cancer or awareness campaigns, it's old white women.
It's generally not us.
No.
And it definitely is not folks who are under the age of 40.
No.
Case in point, the breast cancer screening ages.
Yes.
So I want you to talk a little bit about your experience, because I think that it's important for us to be heard, right? Like, what does this look like for us? Because one of the things that I continue to hear conversations about is the number of Black women who are diagnosed with triple negative breast cancer. And those numbers are very, very high. And that's a more deadly form of breast cancer. So I guess I would like to, I guess my question is how did you know something was wrong? Did you feel off? Like, what made you say something's going on?
I actually felt amazing. Okay. That's the part that's scary. I had gained some COVID weight. I had gained a couple of COVID pounds. I was working out.
Was this 2020 or 2021?
This was 2021.
Okay.
So by now the vaccine has rolled out. People are going back to the gym. I worked at the hospital, so I was in group 1A. Remember they rolled out the vaccine?
Yeah.
And we had groups. Yep. So I was in group 1A. I had my vaccine and I was working out, and I was laying in the bed. I was going to see Dave Chappelle that night because the vaccine had been rolled out. So we were back outside a little bit.
Right.
And I was like, you need to do a breast self-exam. It's been a few months. And I just literally randomly did one. And I felt something that I thought was a tight muscle. And I was like, hold on, what's that? So I called my mom, who's a registered nurse, and she said, send your doctor a MyChart message, which most people have MyChart. It's just an electronic way to get your test results, send your doctor a message, all of that. Sent them a message. They said, come in tomorrow or something like that, today or tomorrow. And I was like, actually, no, I'm going to see Dave Chappelle, so I won't be there. I need to come in Friday. Right. Because those tickets were expensive.
Well, and also, were you like, in your mind, like, I'm good. Like,
Oh
there's
yeah.
nothing wrong. I'm just,
I was like,
yeah.
this ain't nothing. This is just to go get cleared.
Mm-hmm.
Right. So went in, got a mammogram, and then the radiologist actually said, I see something. I want to get some more images. And we also want to do an ultrasound. So fast forward, at the time I was down in Dayton at a health system that was out of network.
Mm-hmm.
So working in healthcare, I
You're
was
like, I
like,
need to get in network.
this is starting to look real expensive.
Right.
I was like,
Facts.
run me those images so I can take them up to a health system in Columbus that's in network. So got more images, push come to shove, advocated for myself because I pressed and pressed and pressed. I was calling like every few hours, like, I need a biopsy. I'm not going to sit here in somebody's work queue for weeks and weeks. So I basically got on their nerves,
Mm-hmm.
got the biopsy, got my results, and was diagnosed within 14 days from the day I found my lump.
What is the general time frame for diagnosis?
Oh my God. If you have a breast self exam, if you do that and then you get your mammogram, you might sit in a work queue, like, which is basically an electronic list that a case manager or nurse is working 30 days, 45 days. Um, but
Yeah.
14 days is really, really fast to go from I found my lump, had mammograms, ultrasounds, got more mammograms, ultrasounds, and a biopsy and test results. That is very, very fast.
Mm-hmm.
So that self-advocacy piece and like knowing the system inside and out is really what got me there in 14 days. But that's not typical.
Right.
Mm-hmm.
Did your mom support you with that? Like, was she in your ear, like the things that you weren't necessarily sure to ask for? Was she helping you along with that? Or did you have anybody else that was like,
Yeah.
obviously, like you worked within a health system, but you're not a
Yeah.
doctor. So was there
No.
other people? And also just the stress, right? Like,
Yeah.
is there other people that were supporting you to help you advocate?
Oh my God, yes. My
Yeah.
mother, my sister, my mom's sister, not blood, but a sister she grew up with, is a registered nurse in Cincinnati. And so we would get her on the line. She works in med surge. So anybody in my family that worked in healthcare, my friends who work in healthcare, everybody was like, it took a
Yeah.
village.
Mm-hmm.
It took a village in so many ways.
The support network is so important, and it's really resonating with me because you know that because I told you that my mom was diagnosed
Yeah.
with ovarian cancer.
Yeah.
Yesterday will be a year, but the way that it went down was she was like trying to advocate for herself for
Yeah.
months. She was like, something feels off. And they're like, oh, you
Yeah.
know, you're that's probably a UTI. We're gonna send you away with UTI medicine. She's like, okay. Calls back. Nothing's happening. I still feel funny. I can't eat full meals.
Wow.
Whenever I eat, I feel full immediately. I'm having like abdominal pain. She had very like clear symptoms.
Wow.
And she ended up getting diagnosed at the ER. She went to the dentist one day, got the work done on her teeth, and when she tried to get up to leave, she couldn't get up.
Oh my God.
And she went to the ER, and there was a curious young doctor in the ER who did a scan on her, and he said, ma'am, I see a mass on your ovaries. You need to call your gynecologist. Now, fast forward, because this is relevant, or
Yeah.
to go back, this is relevant. She had been told by her initial gynecologist that you're over the age of 60, you really don't need to come back regularly.
That's
So
the recommendation. Yeah.
so she wasn't going back regularly. She hits 66 and this happens. And she calls me all frantic. And I, of course, was like, oh my God,
Of
Because I
course.
wasn't expecting for her to say that. I thought she was, I don't know what I thought she was going to say. I didn't think that she was going to say they saw a mass on my ovaries.
Yeah.
And so I immediately called Martina, who also works at a health system.
Mm-hmm.
I was like, I don't know what to do. Like, and I knew what to do, right? Like, cause
Yeah.
I'm smart. Like, I know how to advocate for myself. I always do it. But in that moment, I couldn't like process.
Right.
And she was like, I need you to call the hospital. I need you to ask specifically for this kind of doctor. And I need you to say these specific things.
Yep. Buzzwords. You have to have the right language.
Yeah. And in the interim, my mom had called her gynecologist's office. I told you, yes, tomorrow will be a year, August 28th. She said, I'm in a lot of pain. I went to the ER. The doctor see a mass. They said, ma'am, you're not our regular patient anymore. So we won't be able to see you till October 2nd.
Yeah.
Now, mind you, nobody else in my family works in a health system. So my sister, being a forever optimist, she was like, well, maybe they're wrong. Like maybe they didn't see anything. And I was like, I don't
No.
we can't trust that they're going to treat this with the urgency that it deserves.
Yeah.
And she was like, okay, like let's called Cleveland Clinic and told them what happened. I really think that it was a Black woman that answered the phone on the other end. I could just tell by her voice. And she was like, hold on, baby. And I'm just so grateful for her to this day.
Of course.
That's what she said. And she transferred me to the scheduler. And my mom was in there and diagnosed that Monday. So like 3 days passed. Yeah. And I shudder to think what would have happened had we waited. I know what would have happened had we waited, right? And so it just resonates with me so much when you talk about like that quick turnaround time and how you had a village who was behind you to make sure that you could advocate for yourself to get what you needed. How do people advocate for themselves in a healthcare setting? Like, what are some tips that you have for people?
So the first thing I would say to advocate for yourself is establish yourself with a primary care provider. Mm-hmm. If you're a woman, you need a primary care doctor and a OBGYN. I tell people all the time, have both.
Do you find that a lot of people don't have both?
Yes. A lot of women think one or the other is sufficient. Mm-hmm. And there are specialties for a reason. Mm-hmm. My PCP is phenomenal, Black woman. But there are some things that I want my OBGYN, also a Black woman, to be in charge of. Mm-hmm. You don't want a foot doctor in charge of handling your eyes or your heart, right?
Right.
So
that's intuitive, right?
Yeah,
like, that's intuitive.
Like they went to med school, right?
Yeah,
it's nothing.
It's not the same thing. Right.
Have your specialist lined up. So that's the number one way is like have a relationship with your doctor before you get sick. Mm-hmm. Now, if you're already sick and whether you have a provider or you don't, there are a lot of doctors out there in the world. Not enough, but there are a lot. There are clinics. I would say you have to be aggressive and get your diagnosis or get it ruled out.
Right.
Arm yourself with the proper language. So everybody has a nurse, an LPN, a doctor, somebody in your family works at the clinic or the hospital. Somebody. Mm-hmm. even if she's the receptionist.
Yeah, but she knows
somebody. She knows more than the average Joe about navigating the health system, you know? So lean on your network and the people you know who are inside of the health system because that makes a difference. So that would be number 2. And then number 3, trust your instincts. If you and your soul and your spirit know something is wrong, it probably is. Mm-hmm. Don't get gaslit. Yeah. You know, like no, okay, you said no, fine. next doctor, next clinic, next system.
Absolutely. I think that's so true. And I definitely experienced that with my mom. She kept pressing like, no, I know that something is not right. Right. But this again, I think I was reminded of, I can't say for sure what it was, right?
Yeah.
But just the complete disregard when she called the doctor's office the first time and this, oh, we don't have anything available. What pops up in your mind always is, again, racism.
Absolutely.
Because we see it happen time and time again when our concerns are dismissed.
Yeah.
And this is a big conversation, right, in the healthcare community around dismissing Black folks' concerns about their health.
Yeah. Well, let me talk about that for a minute.
Yeah.
Racism is, it's America. So I tell people all the time when people talk about like, well, the health system is racist and it shouldn't be, and that is correct. Where I challenge people is, why are you surprised? If you live in a society where racism is prevalent, if there's racism at the bank and there's racism at the gas station and there's racism here and there, what makes you think it rolls up on the hospital and it's like, oh, we're not going in there.
Right.
I'm racism. I'm not going in there. It's like, that's not what happens.
When you say you challenge people, do you mean the people who are within the walls of the system? Because I think that I was reading an article where he may be a professor or a physician or something. He wanted to take out language about racism.
Oh yeah.
Because this doesn't belong in our. It's not based in science, which it is, right? Like the who can endure pain and all those conversations are like our gynecological system, right? Our study of gynecology was based off the studies of Black women and our pain, right?
Yeah.
So when you say like people, who do you mean specifically, like that you're trying to like say, like, why do you think racism stops at the door?
Yeah, both people, both Black patients and healthcare providers, because I think if you can, for Black patients, is if you already know something going in that this is something that exists here, then you'll be better prepared. It's like when Black people have to sit down with their Black children sometimes and say, baby, sometimes people not gonna like you just because you're Black. And that's an unfortunate conversation that people have to have with their Black babies. And I think if people know that, they can be better prepared to navigate it and recognize it and know when it's time to exit that relationship and find a provider who is not displaying racist tendencies. So you're not caught by that element of surprise.
Right.
For healthcare providers who think it doesn't exist, let's look at the medical books real quick. You know, just healthcare images alone, there's not really anything in there that even shows our humanity.
Absolutely.
So if you Google just anatomy images like ADAM, I forget what it stands for, but those are like the official images of anatomy. The skin is never brown. So you go and spend, 8+ years in medical school and you never see a brown body in your textbooks, or you don't see anatomy images displayed in brown. Even on a subconscious level, that can develop a mindset that health is something that is for white people.
We're not considered.
Yeah, no.
Absolutely. I definitely also think that there is a class, right? Like there's an assumption that when someone Black comes into my office or someone brown comes into my office, I actually saw a video of this. This was in Columbus.
The recent one? Yep.
Yes. Yep. And it was an argument about Care Source.
Yep.
And I found it really heartbreaking for a lot of reasons that I won't even get into because it's too deep, but for what we're talking about today. But even that really brings home the idea that folks are treated differently within the health system.
Absolutely.
And it affects outcomes for folks.
It does.
Cause that for me, even though I know what I know, was still shocking. It's shocking when people say the quiet part out loud.
Yeah.
And so I wanna ask you too, like, we talked a little bit about the front end of your journey, but I want you to sort of like walk people through sort of your experience as a young person who was diagnosed with breast cancer.
Yeah. So which piece would you like me to focus on, like walking through the health system or walking through life?
I think both is important,
Okay.
honestly.
Okay. So when I first got diagnosed, I was obviously devastated. My faith was challenged. I am a Christian, but my faith was challenged. I will be 100. I was mad. I was
Yeah.
mad at God. I'm like, how you gonna do this to me?
Right.
All this good work I'm trying to do. So I was angry. Um, I was sad. I was all of those things. But then something in me knew that I needed to gear up for a fight. You know, I was like, oh no, I'm not ready to leave here. So I'm leaving here with something. You know, I went into that mode for real. So I geared up to fight and I got organized. I got a notebook because at that point, when you're leading up to treatment, the amount of doctor's appointments and scans, because they want to know how far has it spread. You're getting more MRIs, more CAT scans, more everything, bone scans. I mean, scans I didn't even know existed, and I worked at the hospital.
Right.
So it was becoming like multiple appointments a week to prepare for chemo. So I had to get organized. What medications will I be taking? What chemos? What can I eat? What can I not eat? I went to a second opinion clinic just to make sure that the care treatment plan was best for me, and I went with my little notebook. So I
How do you
approached
get a
it.
second opinion?
You said how?
Yeah, I want people to, because
Oh,
I was completely prepared to do this for my mom, and
yeah.
I knew what I needed to do, but a lot of people think that the first opinion that you get is the one that you roll with. So I want you
No.
to also explain, like, how do you get a second opinion?
You can either Google it. So what I did was I was like, oh, okay, this is what this oncologist is saying. I need somebody else to agree with this, another doctor. So I Googled second opinion. So Ohio Health, for example, has a second opinion clinic. I think Ohio State Wexner Medical Clinic has one. I would assume that they do, but most large health systems have a second opinion clinic. So say you are in health system A, maybe go to health system B and see if they say the same thing. And you can probably call their cancer care center and say, hey, I just got a diagnosis. I'd like to come in for a second opinion. It's really that simple.
And that's across the spectrum, across all different diseases. Like, you can go in and seek a second opinion about what doctors are seeing, and not just a second opinion, but a second opinion on your treatment plan.
Absolutely.
Right.
Yeah.
Because that's another thing that I wasn't well versed on, because I had never been through it before, is that there are different kinds of ways that doctors choose to tackle cancer, because I'm using no cancer is the same. Like that. That was a slogan. Like I learned a lot from that slogan.
Yeah, they're different.
That cancers, like the types of cancers are different, but the way that they function inside of your body is also,
everyone is different,
not the same.
Yep.
So I love that you touched on second opinions. I also want you to touch on clinical trials.
Clinical trials.
Yeah.
Oh man. I want to add something else about second opinion. So it can be time consuming, but when we are searching for hair products, when we're looking for a new pair of shoes or a camera, we go and say, okay, how much is it on Amazon versus Best Buy versus Target? Right? We do that. We have our tabs open on so same thing with our health.
Yeah. Yeah.
Like,
absolutely.
just double check.
Right. Do you think that I think people get scared and overwhelmed?
Of course.
I think that they just I know for me, I'll speak from the eye, which is what someone from work always tells us to do. I was so overwhelmed.
Yeah.
But I knew that, like, at the point my mom was diagnosed, she was stage 3. So she went downhill so fast. It's the best way that I can describe it.
Yeah.
That at a point she really couldn't even communicate with us.
Right.
So it was like I have 3 sisters. My 2 sisters who were local, we had to split up, right? Like we had to figure out who's going to do the everyday caregiving. I couldn't do
Yes.
it because I didn't live close. Who's going to talk to the doctors?
Yeah.
Who's going to have like whatever the third line job was, like if mom needs something, making sure that she gets it. And I was the person that was tasked with talking to the doctors and doing all of
Yeah.
the research. And some days I would get so scared by the stuff that I was reading
Yeah.
that I would just want to get under the bed.
Yeah.
Like there was so many days where I just wanted to, like, I wasn't allowed to really throw tantrums when I was a kid, so my mom would be like,
girl, bye.
please get up. But there was so many days, like the day that the doctor came into the office, like I just remember her coming in there with that white coat, and she sat down and she had the scans in her hands, and she looked at us and she said, you know, I'm Dr. blah blah, and I want to let you know what we saw in your scans. And
Yeah.
when she said cancer or where it has spread to, I wanted to like get on the ground and roll around like a baby.
Yeah.
And I saw myself like on the ground, like it was like an out of body experience.
Yeah.
Like that's the best way that I can explain it.
Yeah.
And I was like, girl, you are not on the ground rolling around. And I wasn't. I was still sitting in the chair taking notes. But inside, I was like screaming because I was like, I didn't have I had enough information to be dangerous, and I had enough education to be dangerous.
Yeah.
But in that moment, it's so overwhelming. And I just like really appreciate you for like breaking it down to people like this, that you can do it. Like you need to get your people together.
Yep. And your notebook.
Right. Whatever way you like to take notes. I did mine in the Google Doc and shared it, you know, with my sisters. But that you can, like, if you can get past that initial, like, and I also just want to say that, like, I have not gone through this.
Yeah.
But I don't think enough of us talk about like what the caregivers.
It's very hard on the caregiver
experience. So I just appreciate you so much for just talking about it in this way.
Mm-hmm.
And like I said, I think that we don't always know what's available to us.
Yeah.
I didn't know that, like, that so many of us don't know about clinical trials, right? Like I never really thought about what a clinical trial is and what it does, of course, but never saw myself in that position, and also never considered how many of us don't even know that is an option.
Oh, yeah.
So can you share a little bit about, what you know? Because I told you I wasn't going to ask you too much of specific questions, but because I wanted us to like stay general. Mm-hmm. But can you talk a little bit about what folks can do there?
Absolutely. So once you're diagnosed, you can ask your oncologist, cardiologist, whatever type of ailment, it doesn't have to be cancer that you're dealing with, are there some clinical trials available? I think that healthcare providers are well aware that Black people don't want to be experimented on.
Right.
And so having that knowledge may prevent them from saying, hey, here's an opportunity for an experiment, essentially, is what clinical trials is.
Right.
Now, by the time a medication or a procedure or some intervention gets to clinical trials, some testing has already happened, you know.
Right. It's not going to hurt you.
Yeah, they're not calling you into a back room and like, you know what, let's just throw paint at the wall. That's not what's happening by the time it gets to clinical trials. So there are some safeguards in place before they start engaging human beings. We do need to be participating more in clinical trials, just so that the medical community can have a better understanding of some of those physiological differences that we talk about, like our skin is not tougher, our bones don't need you to cut harder, you don't need to yank my wisdom tooth
Right.
with more aggression than if I were a white woman. Things like that. I think that if we participate in clinical trials, will help the medical community. We do need to be still vigilant.
Oh,
We still need to
absolutely.
be vigilant.
Let's put a whole blanket over this of vigilance over this
Yes.
whole conversation.
Yes, we still have to be vigilant and aware, but certainly clinical trials is important. As it relates to breast cancer and breast health, there's an organization called Touch that is focused on Black women and engaging them in clinical trials. The founder is a survivor of triple negative breast cancer, which is not very common because it's extremely deadly.
Yeah.
So it's always nice to see somebody who's been through it and a walking testament of survival leading an organization like that.
Absolutely. And I want to touch again on, because we kind of been jumping around talking about both of our stories, but on breast cancer in particular, there was recommendations that came down that said that folks don't need to do breast self-exams.
Yep.
You yourself said that you found your cancer.
Yes.
Or at least you knew that something didn't feel right from a breast self-exam.
Yeah.
What are your thoughts on that? Because I feel like people should still do them.
I am 100% in favor as a woman and as a public health person, professional, of breast self-exams. The reason is multiple reasons. For one, nobody can know your breast as well as you do or your lover. So a lot of people's husbands or partners, girlfriends, wives, whoever their lover is, that's often who finds it because that's who's familiar with your breast. So touching your breast and familiarizing yourself, first of all, to know what's normal and what isn't is crucial. When we go in,
so you're saying get to know your body.
Yes.
Yeah.
Yes. So when you go into the OBGYN and they do your PAP and they also do what's called a clinical breast exam, how many breasts are they touching a day?
Right.
And they're touching yours once a year? You think they know your breast? They're looking for things that are palpable. So by the time it's palpable, which is basically by the time you can feel something, it's been some time for that cancer to build up into something that's big enough to the size of a dime or a nickel or a quarter.
To actually be able to feel it.
So that's what palpable means. So,
and Black women have denser breast tissue. So does that also affect the feel? And I mean, even just different, because I've been trying to familiarize, like I'm familiar with, of course, how my breasts feel, but when you felt something, did it feel like a pee? Because isn't it that you're not supposed to be able to move it, right? Like if you feel a lump in your breast and it's kind of like moving around, that might not be anything to be as concerned about. But if you feel a lump in your breast and it's immovable, that's when you should be concerned, correct?
I would be concerned either way.
Okay.
I would be concerned either way because if you're not a doctor, making that distinction can be challenging.
Okay.
It can be challenging. Going back to your question about the recommendations, there is conflict in the medical community of, do you do breast self-exams or don't you? I am in favor of it. My oncologist is in favor of it. My whole care team was in favor of it. When I went in and to my OBGYN following diagnosis, she's like, and can you believe they're saying don't do those? So
because it can't hurt.
It can't hurt. And especially for Black women or any woman under the age of 40, 40 is the recommended screening age for mammograms. So what is your recourse if you're not doing breast self-exams?
Exactly. So I definitely want to talk about that.
Yeah.
The screening ages.
Yeah.
We've talked about we focused a lot on cancer, obviously, because we both have had experiences with that. But I've seen the colon cancer rates skyrocketing, but a colonoscopy age is like nowhere close to where they're saying that they're seeing like so many cases pop up. The breast cancer screening age is 40.
Yes.
But we're seeing women having breast cancer at younger ages and passing away.
Yes.
From breast cancer.
Yes.
At younger ages. How do you so I'll say I've had a mammogram already. I'm not 40. But like you said, I advocated for myself. When I found out that there was a linkage between ovarian cancer and breast cancer,
Yeah.
I was like, oh, I'm
We
going
need
to
this.
demand that I have a breast cancer screening
Yeah.
earlier. So what are some like specific, and it may be like the same things that you said before about
Yeah.
advocating for yourself, but what are some specific ways that you can sort of like approach that? Like if you're like, I actually want, even if you don't feel like it, because you don't always feel like anything's wrong,
No, you
right?
don't.
Which is why mammograms are so important. Like, how do you advocate for yourself in that particular setting?
Yeah. You have to kind of be aggressive.
Yeah.
Yeah, you have to be the squeaky wheel for sure.
Mm-hmm.
I want to go back to the screening age question first, though. So the screening age is set typically by the United States Preventative Service Task Force. Long title, long name. That is related to legislation. Legislation is related to legislators. Legislators are related to voting.
Voting, right.
When you vote in legislators, they make legislation, and then it impacts whether the screening age is going to be 40, 45, 50, whatever they decide, because funding is important, as well as, priorities of our politicians. With the screening age being 40, if you are someone who is, say, 35 or 37, particularly for breast cancer, and it runs in your family, press hard. If that provider will not listen to your concerns, go to another provider. Now, do I think that everybody who's 22 and wants a screening should be doing that? Probably not. I'm honestly not sure at what age you start to be a little bit more aggressive, but I know 40 is not the age.
No.
Because especially for Black women, we're more likely to be diagnosed with breast cancer under the age of 40. And if your diagnosis comes before age 40, you're more likely to be triple negative or have an aggressive form of breast cancer. And that's why for the Black women you see diagnosed under 40, we're dying, basically.
Yeah.
And those are the reasons why.
Yeah. In terms of the screening age, right? The other thing that we haven't talked a lot about is like insurance, right? Like,
oh yeah,
'cause there was some legislation that came down in Ohio about breast cancer screenings and you being able to get them at no cost, but it's at 40 again, right? So we see people who are uninsured or underinsured, skipping these screenings because they can't afford them.
Yes.
What is your take there? What would your advice be there?
I would say if you're in Ohio specifically, if you just Google Ohio Department of Health free mammogram. Yep. The name of the program, it's an acronym. I can't remember what it stands for, but they do have a program where you can get free mammograms.
So if you want a mammogram in the state of Ohio, you will be able to get a mammogram with a little research. Now I know African American Wellness Initiative, they also have a women's event that they do every year that they partner with I think it's Ohio State.
Yeah.
And they provide mammograms for folks. So the takeaway there is that if you are wanting to access a mammogram, there are avenues out there if you are uninsured or underinsured. Also, Planned Parenthood, they do mammograms as well. A lot of people don't know that. There's lots of different health services that Planned Parenthood does. So there are access issues, no doubt.
Of course.
But there are also access avenues for people if they're interested in getting mammograms.
Yeah.
A little bit about disinformation, because I keep seeing Black women saying, I don't want to get a mammogram because of the radiation.
Yeah.
Can you share a little bit about your thoughts on that?
Yeah. So here's my opinion on misinformation within the Black community. And I'm going to use COVID as an example and just challenge people to think about things more strategically. I'll use that word.
Yeah.
So when COVID first started, there were a lot of conversations in the health community being led by Black providers that there was not enough access to the vaccines.
Mm-hmm.
So then it became, oh no, Black people didn't want it. So it went from, wait a minute, you're not giving us access, to, oh yeah, we don't want it. I don't think that was by accident that the messaging got flipped. So think about that situation when seeing things like, oh, don't get a mammogram because it's going to give you breast cancer. You know, ask yourself, what is the source of that information and what could potentially be motivating you or encouraging you to skip screenings that can be life-saving.
Right.
So I would challenge people to be a little more thoughtful about that.
And check your sources, right?
Yes.
You can't always and I think that in general people understand this, but you cannot look to an Instagram guru or a YouTube guru who doesn't have any real credentials
Yeah.
to give you the health information that you need. And I also think that for some folks who tell me that they want to focus on like holistic medicine, right?
Yeah.
Like I think that those two things can exist
Absolutely
in the same space. So, my mother did chemotherapy, but I also said, like, let's focus on diet.
Yes.
Let's focus on lifestyle. Let's focus on what products you're using, what products are in your home.
Yeah.
And that is another thing that I want to touch on, right?
Yeah.
Because when my mom was diagnosed, I didn't know that there were ways to screen for like heredity, right? Like,
yeah.
And the doctor said, well, we're gonna screen you so that if we need to take next steps with your daughters, that we'll be able to do so. And I was like, excuse me, next steps of what? I was like, why am I in it?
Why we got next steps?
Like, and I say all this to you like not tongue in cheek, but for real, because it's easy to like talk about stuff until it's actually you.
Yes.
And I was like, it just did not cross my mind initially that like, okay, my mom has ovarian cancer. This could possibly be something that I end up having, right?
Yeah.
And so we talked about the genetic testing. Genetic testing comes back, your cancer is environmental. Now, environmental can be outside in the air.
Yeah.
But what else is environmental?
Everything.
What else does that mean?
Oh my God, everything. Everything that we interact with is our environment. It's air quality, it's water quality, it's the food that we eat, it's the stress of work and our home life, is everything. What we put on our bodies, what we put in our bodies, what we wear. A good example, I bought a shower cap from Target once, and I got it home. It was a cute little pink shower cap. And on the back of it, it had a California Proposition 65 warning.
Yes.
That basically said this shower cap causes cancer. And I was like, we can't make a shower cap that doesn't cause cancer? I mean, come on, we have technology, right?
Mm-hmm.
So that's an example of our environment.
Mm-hmm. The pots that we cook in.
Yes, the pots.
The non-stick pots that we grew up using.
Yeah, the beauty products.
The beauty products. And you focused a lot on that, right? So I ended up, I'm a person that loves smells. I love a good perfume. Okay.
I do too.
Like, love it. Love a good lotion.
Yes.
But I have started to, instead of like your body is a sponge, right? Like whatever is coming up in the bottom of your feet is going up through your whole body. Whatever you're putting in your skin is going into your pores, right? And going into your bloodstream.
It is.
And so I have started to really be a lot more mindful about even the beauty products that I'm using, and the forever chemicals, or what some people know as PFAS. Like these chemicals, and you can, to not go too deep into it, like there are apps that you can use when you're shopping that can help you detect this stuff. Like I don't think either of us are saying like put yourself in a bubble and zip it up.
Yeah, no.
Because some things that you just
that's bad for you
cannot
too.
right. That's bad for you as well. Like, but I always bristle when people say, well, everything causes cancer. There are ways that you can take steps just within your own personal control, right? To be more mindful about what is going into your body and what you are exposing, like yourself and the other people in your household, your family members, like the cleaning products you use, all of that stuff. I won't lie and say that I was able to do those things overnight or make those changes overnight.
Right.
But there's a natural solution for a lot of things. So instead of me like, using Fabuloso to mop my floors and just stepping all over it.
The purple one.
Yeah, like, because I like the smell of, I love the smell of Fabuloso. I mean, I grew up with it, right? I started to use like vinegar and water or like baking soda. Like, there are natural solutions, and they're not just like you make them yourself. They're also on the shelves, right? And so I love and appreciate how you have really talked a lot about that. Yeah. And one thing that unfortunately is like controversial, right, is this idea of, but science research that has shown that relaxers, which a lot of us have grown up using, that they have been linked to different forms of cancer. Yes. Can you talk a little bit about that?
Absolutely. So relaxers. Now, I'm not going to sit here and act like I didn't used to like me a good relaxer.
I still love I had a relaxer. Okay.
I had color and relaxer. Fried dye, legs at the side.
Period.
With
like,
the
why
swoop.
Is my bang
with the swoop.
Disappearing? It's because you dyed it and put relaxer on it. Just weeks apart.
Relaxers were a thing. And then boxed relaxers was, oh my God. The fact that was ever a thing is just,
Wow.
So we've come a long way. But yes, relaxers have formaldehyde in them. They have lye in them. They have phthalates in them. They have a lot of different ingredients that are mixed up in somebody's chemistry or chemical engineering lab that make it have a long shelf life. That make it do what it does to our curls, and that it's not good for us. And like you said, our bodies are absorbing everything we put in or on our bodies, and it is linked to cancer. And that's just one of the many beauty products that is linked to cancer. I don't know if everybody's algorithm works like mine, but a few months ago, it was like all I saw on Facebook were class action suits about cancer and relaxers. And then one of my friends who's a stylist is like, everybody is getting relaxers. And I'm like, y'all not seeing the Facebook warnings?
Yeah.
Okay.
Yeah.
All right.
I think it's going to take a lot of conversations like the one that we're having, because for me, I understand why people get relaxers.
Yeah.
Right? Like, it's ease of use.
Yeah.
It's ease on your everyday. It's the beauty standards that we've been taught to revere. And so I understand why people do it, but just like flat out, it's harmful. Yeah. Like, if anybody wants to tussle in the comments with me once this episode comes out, please do. I love y'all. I love the beauty industry. There are family members that I have who that is their bread and butter. Yeah. But the science and the research says what the science and the research says. And there's actually a long form article that just came out in the New York Times about this. So this is not us just saying this to try to deter anybody from presenting or showing up in the ways that make them feel beautiful. Yeah. But it's just to say that these flat irons work real good. Now, they might not work
don't get caught in the rain.
Right. When I get caught in the rain, I'm just shit out of luck because my hair is going to curl up. But I think that there are healthy alternatives to get the looks that, however we want to present, to have an opportunity to achieve those. Yeah. But the fact remains that I want people to do their research about how harmful, even
Yeah.
fibroids, right? Like,
Yes, the
are linked
fibroids.
to us. So many of us having fibroids is not a coincidence.
Not at all.
It's been linked to relaxers,
Yeah.
uterine cancer, ovarian cancer.
Yes.
All of that has been linked to relaxer use. And so I really wanted to make sure we touched on that environmental
Yes.
piece, because again, it's something that I'm having to like deal with head on.
Mm-hmm.
And has caused like a total life change for me. Things that I used to love doing, things that I used to love using.
Yeah.
I just can't do them anymore.
Once you know, it makes it really challenging, especially if there's an alternative. Like I've transitioned like you to a lot of products that don't have fragrance, sulfate free, phthalate free.
Now, phthalate is when you're looking on the label, it starts with a P.
Yes.
The P is silent.
The P is silent.
I try to break everything down on here. Like if you're looking at a product, I just want to say like no parabens.
Yes.
Like looking for all of those things, because those are the chemicals that like, they're just not part of our chemical makeup, and they cause our cells to transform in ways that are not great for our physiology.
Yeah.
Right. So we talked a little bit about that because I really wanted to talk, because I'm like super passionate. I could talk about that all day. And I know my husband is tired of me being like, oh, this has a smell, throw it out. Like, but I also want to talk about the crux of like the work we do at Columbus Can't Wait, which is like political work, right?
Yeah.
Like how does this show up in the health equity space? So you talked a little bit about this at the beginning of the show. You talked about the CDC, all the way down to city council.
Yeah.
Dig a little bit deeper for the people about what you mean by, you know, this is something that we can actually have some control over with our vote.
Yes. So I'll talk about the Affordable Care Act a little bit, also known as Obesicare. Barack Obese pushed the Affordable Care Act through, and I know a lot of people have issues with it, but I don't think that we realize how it impacted our lives. Mm-hmm. So when we vote, when we go to the polls and we select who we want to represent us in political office, we need to be mindful of their interests, their agendas, and how it will ladder up to the next level of government and the next level and the next level. And I know that's a lot of information, but if we can sit up and watch a 2-hour podcast about people getting drunk, we can spend
I love murder podcasts, so I'm that person that like I just was watching the Lacey Peterson documentary the other night, and like Scott Peterson, sociopath.
Yeah.
Let me not say that about that man. I'm not gonna diagnose him, but something is wrong with him.
Yes.
And then I watched it and just went straight to sleep. I'm like, is something wrong with me? I'm like that meme. Like
you were traumatized.
Exactly, but go ahead.
But my point is, we love entertainment. And it's like, if we could just sit down and spend just 2 hours between now and election and understand who we'll be voting for. You can get sample ballots, who we will be voting for, and what policies or initiatives they are backing. That will make a big difference. The reason that's important, again, I'll go back to legislation. Legislation and policies are the ways of how things are allowed. They set kind of the guardrails.
Right.
So just like we have a speed limit, you can only go 65 in this zone. You can go 70 in that one and 35 in that one. It's the same thing when we look at politics and how it relates to screening ages and how it relates to what we pay for and what we don't. Under the Affordable Care Act, Medicaid was expanded many years ago, and that was a fight. I remember I was working at CareSource at the time, which is a Medicaid managed care org, and they bought a bus of us up to Columbus to march and protest for Medicaid to be expanded under the Affordable Care Act. If it wasn't for the Affordable Care Act, there would be nothing to expand to.
Right.
So it opened the door for the opportunity for states to say, okay, let's all use small numbers. There are 10 people who are eligible now. But because of the passage of the Affordable Care Act, let's say now we have the opportunity to say, okay, are we going to do 15 people or are we going to leave it at 10? And so Ohio ultimately ended up expanding Medicaid access, which really gives people who were falling in that probably working poor category access to health insurance and healthcare providers. And so that's just one of the many examples of why it's important to have people in office who align with our interests, especially when it comes to our health.
And who see healthcare as a human right.
Absolutely.
And not a privilege.
Absolutely.
Is there any specific legislation that you can point to that's happening right now that people should be aware of?
Yeah. So Vice President Kamala Harris is doing a lot of work in the maternal mortality space. Black women, I believe, is 4 times, is the statistic, 4 times more likely to die in childbirth or immediately following childbirth. And so I know that's an issue that's near and dear to Kamala Harris right now. So that's something that is underway, and that translates into programming.
Right. And programming, and also access to things that can bring down those numbers. Like, how do we give people access to birth workers and doulas and midwives? And how do we bring the idea and the practice of that out of, folks seeing that as like secondary, but actually seeing those folks as medically necessary to provide additional care and support for a mother. And all of that is really pivotal and important as we think about what we've been talking about this entire time, which is systems, right?
It is a system. And you just said something that made me remember that Medicaid, there was a push for Medicaid to cover doulas. We know that doulas are not a one-stop shop. They're not the end-all be-all to solving the maternal health crisis, but they are a huge part. Doulas and midwives. Well, they have to get paid too. They're not free.
Right.
So pushing for Medicaid to cover things like that is, again, related to who's in office. For us to even have the opportunity as society to say, yeah, we want this. Now we need you to do it.
Yeah. Policy matters throughout this whole conversation. One of the things I always talk about in my work is like policy is like absolutely important, and we need policy. We also understand that policy can take a long time depending on who gets in office, right? And what that person has political will to do. It depends on who's in Congress. It depends on a lot of different things. And we talked about this from just a personal level, right? Like our community support dealing with cancer. But how can a community also be of support as well? And what I mean is, like, when I say that, I mean supporting like some of the grassroots organizations that are deep in community with people, to have sort of the conversations that we are having, but also provide practical support. And so I will die on that hill. That we need to be thinking about both, because I do think that like that peer-to-peer support, there are so many like doula collectives and birth worker collectives that are doing God's work in the community to care for folks. And so what are your thoughts on that, like being like a multi-pronged approach?
Oh yeah, we need it. We definitely need the community piece. That is where it becomes tangible. Policy and advocacy is super, super important because it allows the opportunity to do the work via funding most of the time and grants and things like that. But that community work, when somebody shows up on a Tuesday at 6 p.m. every week and says this is a support group for mothers who were victims of maybe infant mortality, or a birthing group where doulas get together and share ideas, those things are very, very important, whether it's tangible or if it's conversational, is all very important and impactful.
Mm-hmm. Well, I'm just super grateful again to have somebody like you who I think understands. There's not enough of us like in this space who understand both of those things and how to be in community with people, but also who understand the policy piece and why it's so important. And I just want to thank you because I don't think that I could talk about anything that we ever talk about on Columbus Can't Wait. To me, your health is the cornerstone.
It is.
Of everything, right? And if we can build healthier communities, that to me is unlocks a lot of potential for us all. And like we all deserve it.
We do.
Yeah.
We really do.
Well, Rachel, thank you.
Thank you.
I'm so grateful for you for sharing your story too. Like I candidly was like nervous that I was going to be like very emotional.
Yeah.
So I appreciate like your support sitting across from me.
Absolutely.
Just like because I needed that. But I also think it's important for Black women's voices and Black people, our voices to be heard in this space, our stories.
Yeah.
To be heard in this space. So I feel like you're one of our like I don't like the word crusader for obvious historical reasons. But you're one of those people I feel like carries the torch for this work in Columbus.
Yeah.
How do people, first of all, I want to make sure people watch your show too.
Yeah.
So how do people find you? How do people get in touch with you if they want to do business with you?
Yeah. If you Google Black Health Lit, it'll pop up, or any social media platform. Instagram is where I live mostly. I touch my toe in TikTok every blue moon.
I know, it's so
I like TikTok.
I love TikTok though. Like
I like watching.
I like watching, but in terms of posting my own content, I'm always but
yeah,
man, I go through so many emotions on TikTok. I go from like crying because I've seen somebody's grandma get their birthday cake to laughing to being like, oh, a cute little otter. Like it runs the gamut. So.
It moves too fast for me.
Yeah,
TikTok is like. But just Google Black Health Lit or any of the social media platforms. You'll find me there.
Okay. And your website is also blackhealthlit.com?
Blackhealthlit.org.
Okay.
If you put in .com, it'll take you there too.
Okay. Yep. So if you want to get in touch with Rachel or again do business with Rachel, because as we mentioned, that she also has a consultancy practice.
Yes.
You can find her there. Any last words? Anything you want to share?
Vote. Vote like your life depends on it, because it really does. That is my message this year.
Facts. All my guests that's been their last word every time.
Like, don't play.
Yeah. Don't have us upset out here. Like,
no.
I want people to engage, but please engage with the ways.
Yeah.
The right way.
Yeah. Show up and vote. And that's it.
Facts. Thank you.
Thank you.